Hi, thank you for joining us. This is SeniorLivingGuide.com podcast sponsored by Parish Medical and Healthcare. SeniorLivingGuide.com is a senior-focused website providing seniors and their caregivers with an opportunity to find the best senior housing and resources that best suits them in assisted living, home health care, independent, retirement, and other senior resource options. Visit us online today at SeniorLivingGuide.com. So today we have Dr. Pam and Janet as our guests. Dr. Pamela Trinetti is a geriatrician, a physician who specializes in the care of senior citizens. And we also have Janet Rooks as well. She's a social worker with a background in psychology and dementia care specialist. They work together at the Parish Senior Consultation Center, where they focus on the care of patients with dementia. Dr. Trinetti is the Director of Aging Services at Parish, and Janet Rooks coordinates Parish Senior Solutions, which provides education, resources, and support for seniors and their caregivers. Welcome, ladies.
Thank you.
Thank you. Happy to be here.
Yeah, we're so excited to have you here today. So I wanted to talk to you. One of the things that we're going to talk about today, or the title of our podcast today, is Things Are Gonna Change, and You Gotta Change with Them. That's life, right?
Oh, that is.
That's no one gets out of that. No. Like my mom always said, you know, nobody gets out of it. It's just it is what it is. There's nobody. I know some of the 20-year-olds think it's not going to happen to them, but it is. Yeah.
And that's the big difference is as people get older, it's, Doc, is something wrong with me? Or am I just getting older?
Right. Yeah.
Or I'm old.
I'm old.
I'm just old.
Yeah.
And maybe there's something we can fix.
Yeah. Well, I mean, technology is getting better. There's a lot more things you can fix on different sides of the body, for sure, I'm sure. But so we're going to talk about literally everything today.
Inside out.
Inside and out. So let's start with the outside, talking a little bit about the obvious signs of aging, which would be the skin.
Yes.
The wrinkles, all that kind of fun stuff. So give me a little bit of idea on what are the things that the changing of the skin and things like that. What are some things that you can do or signs of aging that you address?
Well, you know, there's a lot of changes on the skin and a lot of little growths and a lot of little new stuff popping out here and there. And when a physician looks at things, we can often tell, okay, yeah, this is just a normal change of aging. Don't worry about that little mark. But they did a study years ago where they had all these chairmen of departments of dermatology from all these universities, and they had these patients come in and they had to look and say, is it cancer or is it not? Is it cancer or is it not? And only 50% of the time they were right.
Really?
So if you have something on your skin that you're a little bit worried about, show it to somebody. Let them take care of it.
Better safe than sorry.
Better safe than sorry.
Yeah, exactly.
Yeah, and you know we're in Florida, and the sun's out there, but the damage was done years ago.
Right.
Back when sunscreen was not something that we used, so the damage is there. You know, I grew up. You lathered on the baby oil with iodine, or the Hawaiian Tropic with no sunscreen in it whatsoever.
I can still smell it.
I can too. Oh, it takes me to a tropical island.
The amplifier.
Yeah.
Yeah.
And or you laid on the aluminum foil, the thing, and and it was like, oh, and so it was, and you got that first burn, and if it peeled, then that was your base for your suntan, and that's when the damage was done.
Right.
But that's no reason not to use the sunscreen now.
Are more people prone based on hair color? If you have more freckles, that type of stuff, is that something that maybe would predetermine whether you're more likely to get?
You are more likely for sun damage, but you're not totally immune.
Okay.
You can have olive-colored skin and still have a skin cancer, so don't discount that.
Yeah. Oh, wow.
And you mentioned what does the sun do and what did smoking do? Because everybody smoked for generations. And yes, that's the wrinkles for a variety of reasons. You know, as we get older, our skin gets a little bit thinner. And so we're more prone to little tears of our skin, little micro damage and bruising.
Right. Is there anything you can do to help combat that?
Well, some
Or
of
is that
it,
just natural?
as we get older, our skin dries out too. So the key is moisturize, moisturize, moisturize. A moisturizing soap and a moisturizing shampoo, and then a good thick lotion.
Okay. Yeah, is there anything specific in the lotion, like shea butter or anything, or is it just any kind of moisturizing lotion?
Well, I'm a big fan of Eucerin cream that's in a jar. It is
Okay.
like frosting
Yeah.
to put it on, but it does give you that deep moisturizing.
And I can say it works. I use it. It's a little difficult to get on initially. I mean, when
Okay.
you start, it's like, oh man, this stuff. But then it's like, oh, it feels so good.
Okay,
And
very
you know,
good.
and it because the skin does. I mean, it takes very little as seniors, as people age, when the skin is so thin, and they'll have the skin tears, and it's just bumping up against something will cause the skin to tear.
Right.
And you know, and with those skin tears, it's like peeling off a peach.
Right.
Just peeling off the skin of a peach, and it just lays open.
Right.
And they'll say, "Oh, I'll just put a bandage on it." Well, no, because the skin needs to be put back where it was for it to heal correctly.
Right.
And we've seen some pretty nasty
And then
skin tears.
And then it bruises.
Oh yeah.
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 Yeah. I know my dog loved my mom. Loved, but she'd always jump on my mom, and I would like stop, because it doesn't even matter. Just even a little scratch on my mom with my dog's nails would turn into, it would always tear her skin, and she would bruise, and that would be like my mom's worst tears. And I'm like, my dog loved her. My mom loved my dog, but you have to be really careful of that. So yeah, I understand that completely.
Yeah, because you're worried about infection then
Yeah.
coming into the skin.
Absolutely. So it's little things like that you don't think about in everyday life. Just a dog jumping on an older person, you have to be really careful about that even.
Yeah. Or even, you know, a child climbing up in their laps, because it can cause the skin to kind of peel away.
Oh my gosh.
If it's, you know, depending upon, they've got their tennis shoes on and they're climbing up in there, and it just kind of peels. So you have to be really careful.
Yeah, exactly. Exactly. So another thing that, you know, you always joke about, you know, I think there was a TV show, and I can't even remember which one it was, but I think it was a Golden Girls episode, is Sophia, where she said, "I'm shrinking." I don't know. Do you remember that episode? Does that actually happen? Do people like shrink in their height as they get older?
They do. It's 1 centimeter, which is about a half an inch per decade after age 40.
Oh.
So you get a little bit shorter, and there's a couple of reasons for that.
Okay.
One, your feet flatten. Generally speaking, you lose
Okay.
your arch. So people will come in and say, my feet are growing. Well, no, it's just your feet are flat.
Oh.
So now you're a half size different. The other thing is the discs, which are like the little gumdroppy cushions between your vertebrae, the little backbones. They dry out and they flatten. So it's just as if you squeeze down on a gumdrop. So that's that little bit of height loss. Those discs dry out. That's kind of the theme for the day. Everything dries out as we get older. Just keep that in mind throughout our little discussion here. So
keeping those really, even your feet really moisturized is helpful.
well, it's not going to help the fact that your arch is going to flatten. You know, there's a few things that are going to change. You know, there's seasons to our life, just like your nose continues to grow. Your earlobes get bigger as you get older. I used to think that all my elderly aunts just had those big clunky earrings and they were pulling on the ears, and that's why their earlobes were so big. No, the earlobes of the nose continue to grow.
Did not know that.
Yeah, and the bridge of the nose gets broader.
Oh, wow.
So yes, you're shorter, your nose is bigger, your earlobes are bigger.
Right.
So-
So you literally change.
You do.
Okay.
Yeah.
Very cool. So, or not cool, but interesting,
Mm-hmm.
I guess I should say. And then also there's a like weight change that happens.
Mm-hmm.
And I know that anytime, especially women, focus on this, even just going into like the menopause phase of life, there's the weight change. So does that continue as you get into more of a senior phase, or does that something that just transitions in that stage of life? And is it the same for men?
Well, there's the body fat.
Yeah, there's always
the
body.
body
We
fat.
have to have body fat.
Right.
Women have more body fat than men. Men usually run about 20%. Women are closer to 25%. All depends if you're a bodybuilder, that kind of thing.
Right.
But again, after age 40, you can increase body fat percentage by 1% per year. So if you're 25% at age 40, by the time you're 70, now you're 55% body fat. It's just pretty much downhill from here. I want to tell you. I
this
don't
is
have
a very uplifting
I know.
podcast. So get your tissues and. But yeah.
Right.
Yeah, but that's if you don't do anything to change it.
Right.
If you continue to try to exercise and eat right, that can help reverse some of the expected increased body fat as we get older.
It's just like a couple. They can, say you got 20 pounds they want to lose. The man can change his diet and he can drop that 10 pounds easy. The woman, we've all seen those little characters, the cartoon things. The woman can change her diet, do the exercises, and lose 2 pounds.
Exactly.
So, men lose it quicker. They have more fat and it just happens. We
So
like to
unfair.
hold on to our fat.
Right.
Well, that's because we need it, because that's where estrogen is basically processed. So, people will say, well, what would happen like to the women who were in the concentration camps? What did they do when they had their periods? They didn't have them.
Right.
Because as you lose that body fat, your estrogen isn't produced. And that's what we're seeing in our young girls who are gymnasts and ballerinas. They don't have enough body fat. So they are getting osteoporosis at very young ages, which, as we go back to height, we said, okay, 1 centimeter per decade. And you say, well, gee, I know people who are like 6 inches shorter than when they were in their 30s and 40s. That's because they have osteoporosis. So the little change in height, no, we can't do much about that. The osteoporosis is something, yes, we can try to prevent that and maintain our height.
Yeah.
Janet and I are very depressed because we've just had our bone density
Yeah,
test, and we're getting shorter, aren't we, Janet?
I'm a textbook. I'm right there with that. I mean, I walked in. I had my DEXA scan, my bone density scan day before yesterday, and I was 5'9" in the 7th grade, and I am now 1.5 inches shorter than I was then.
Wow.
And I'm not happy.
Yeah.
I have accepted it, but I'm not happy. And I do a lot of walking. I do the, I did the Space Coast half marathon. I do a lot of 5Ks. I'm an active woman. And I take the over-the-counter stuff that my doctor has prescribed to me, told me to take. And I'm hoping that the DEXA scan is not, that it's okay.
Right.
But, I'll do what the doctor tells me to do
Right. Exactly.
because I trust my doctor.
Exactly. And that's the right approach.
But I am
to it.
classic.
Yeah.
I'm normal. I'm normal.
I'm very afraid I'm 5'3". I'm going to be like super short.
Petite.
So I'm
Petite.
petite.
Dynamite
Yes.
comes in small packages. Keep that in mind.
This is true. I'm small but feisty.
But you see that all how it changes how our body looks, because as we get shorter, you should be able to take your hand and put it between your ribs and your hips. As we get older, maybe you can only get 2 fingers, 1 finger, so now your ribs are literally on your hips, so you've become short-waisted all of a sudden. You say, wow, my clothes don't fit right. And my belly is pooching out now. Why? Because there's less room for all those internal organs. All they can do is go forward.
that is the best explanation that I've ever heard for that's absolutely excellent, because I've never heard that explanation. It's always been based on something metabolism, all kinds of different things, but that actually makes more sense.
And we've seen the individuals that have the like the hump on the back.
Right.
It's not because of bad posture. It has to do with the vertebrae in the back.
Very interesting. So, question on the osteoporosis side. When would you recommend someone start getting checked for that? The bone density, I'm assuming that's what you're referring to. With osteoporosis, you would have a bone density test. Is that correct?
Yes, and you know, there's also the National Osteoporosis Foundation, the American College of Gynecologists. They all have different levels. Usually it's by menopause, unless there's an earlier reason to do so. And I've seen numbers from 45 to 55. So it's something to start thinking about during those menopause years. And, you know, along with your mammogram, which is so important, ask for a bone density every couple of years.
Yeah, so that's something that really should be started before you enter those senior years.
Absolutely.
So if you're a senior, you should already have been actively having that checked.
Yes.
Okay. Yeah. Are most seniors on medication for osteoporosis? Is that something that's normal, or is that something that, you know, some seniors are on, some seniors aren't? Is that...
It's something that's common.
Okay.
And again, it's individualized. Some people, you just recommend, you know what, we need to check your vitamin D level, make sure you have vitamin D. We need to make sure you have enough calcium, so you have the building blocks for your bone. We want to make sure you do weight-bearing exercise, which is walking, dancing, marching. And then there's a subset of people that you say, you know what, we really need to have you on a medication. Why? To prevent fracture.
Okay.
So those are the folks that we choose carefully, choose wisely, monitor, and, you know, match the right medication if needed to the right patient.
So vitamin D and calcium are good vitamins to take. Double check with your physician if you're taking other medications, like we've discussed in a previous podcast. We can definitely touch on that again in case anyone from a previous has missed our previous podcast. So do you want to talk about that for just a minute?
Well, they bind together, they work together, but you need to talk to your doctor. If you need to have a good physician that you have a good relationship with, and if you have that candid conversation with them, if you've noticed that you need that preventative annual physical, and that should be part of your physical, is, you know, your weight and to see how tall you are. But you also, you know, there's certain preventatives or annual things that you should be doing, your lab work and this sort of thing. But as you get older, is, you know, certain things that the doctor may or may not order, but that's a conversation you need to have with them. And so, yeah, ask them, you know, it would be appropriate for me to do this. I heard it on a podcast, you know, would it be appropriate for me to have that? And if so, but they may want to do some lab work, because you don't just go out and start taking medication. And the supplements are a form of medication, because you could get in trouble with it.
Right, exactly.
And we have seen people in our office that have taken copious amounts of over-the-counter meds, and it's either they've got expensive urine or they've messed themselves up.
Gotcha.
Yeah, so your doctor, your PA, your nurse practitioner, all good sources.
Exactly.
Because they know what other medicines you're on, what else is wrong with you. So.
Right. And another thing that we talked about is making sure that you're getting all of your medications at one pharmacy. Yeah. So if you're ordering them online and then you're going to another pharmacy, make sure that the pharmacies that you're going to, maybe taking all your medications into the pharmacy you're doing a pickup, to make sure that they know everything that you're on. So the interaction, I know you talked about that before.
Exactly.
Absolutely.
Yeah. So that's really great information. I don't think people always think about that, because they don't realize not everyone's talking to each other, or there might be interaction. So that's always good information.
And one thing that, and I've learned this from Dr. Pam, is that sodas, the carbonation in sodas, leaches the calcium out of your bones.
Yeah, it's the phosphorus.
The phosphorus out of your bones.
Yeah, so people who have a 6-pack of sodas a day, and there are people out there doing that, they have greatly increased risk of hip fracture.
Oh my gracious.
Mm-hmm.
So that's good to know, like way ahead of your senior years.
Absolutely.
Mm-hmm.
Yeah, for sure. And I know that the 80s babies who are entering that, getting ready to get those AARP cards were raised on a lot of soda.
Oh yeah.
So they're going to be more primed for that, most likely, I would imagine.
That carbonation and everything.
Yeah.
Absolutely.
Yeah. So, because I remember those. Interesting. So we said we were going to talk about everything. So let's talk a little bit about probably one of the most vital, well, I would say the vital organ. You need a heart. So let's talk a little bit about the changes that happen in the heart as you age.
Well, your heart is a muscle.
Okay.
And you know that muscle under your upper arm that's kind of a little bigger now than it was because it's kind of hanging down just a tiny bit? Same with your heart. It's a little bigger, maybe not as strong as it used to be.
Okay.
So it's common. Is it something you can do something about? Yes, you can, because we just said the heart's a muscle.
Right.
So again, exercise. Keep that heart moving. Keep it pumping. But don't put extra strain on it. For every extra 5 pounds that you're carrying around, that's an extra mile of blood vessels that your heart has to pump through. So you're making your heart work harder. So we're right back to diet and exercise as the key to health.
Wow. Yeah, exactly.
And a healthy diet. You know, there's a lot of diets out there that aren't healthy. There's heart healthy diets, American Heart Association. But, know your numbers. Cholesterol, triglycerides. Know your numbers. And find a good, healthy diet to support what your body needs.
Right. So basically, when you say diet, you don't mean like go on a diet. You mean a well-balanced daily diet, lifestyle diet.
Well, it could be both.
Okay.
Or either. It could be either.
If you're over the recommended weight. Okay.
There's folks out there that
Understand.
that could lose a few pounds.
Absolutely.
Probably.
Absolutely.
Yep, to take that workload off the heart.
Off the heart.
The heart's a muscle, but it also has an electrical system. And, you've heard of older people, they need a pacemaker. And a pacemaker is a light switch because as we get older, that electrical system can kind of, those old toasters with the cloth
Outlet. Plug in.
Yeah, the cord.
Yeah.
The cloth cord. And they kind of unravel a little bit. Think of that electrical system, get little calcium deposits. So older people might be more prone to an irregular heartbeat. I absolutely love the little watches that can do the EKGs because that might tell you, hey, my heart is skipping a beat here. It's a little irregular. And that way you could get it checked early and either get on the right medicine or make some changes that might help that.
And part of the your preventative physical, Medicare physical, is to look at what your heart is doing, the EKG.
Okay, so every year you are eligible through Medicare to get an EKG
In the doctor's office.
in the doctor's office. Oh, that's very good to know.
To
Okay.
look at the rhythm of your heart.
Okay, very good. And does that provide a really good baseline for how healthy it is in order to know if there's medications you need to go on or how at risk you are for a potential heart attack or anything of that nature? Is that what that...
Well, an EKG is looking at the rhythm of your heart, and sometimes by looking at it, we can tell, okay, the heart looks a little bit enlarged. The next step is what's called an echocardiogram, an ultrasound of the heart. Very easy, just like you do an ultrasound on a pregnant woman. You do it on the chest, and you can see the strength of the heart, the valves in the heart that open and close. It's absolutely fascinating. And then you can do, of course, stress tests and the cardiac catheterizations to get a really good look at the arteries that feed the muscles of the heart.
Oh, wow. Okay, so that would just be the first step.
Step one.
Step one, to knowing if you need the additional steps or not.
Exactly.
Okay, once a year. It's like just on your regular checkup. So if you do some of the dieting and the exercise based on the recommendations of your physician and you're successful, does that heal the heart? Does it, strengthen that muscle, or does it just stop the deterioration of the muscle?
I can't even say yes to any of those because time marches on. We're going to have those changes. And one person gets to be 100 smoking and drinking and they have a great heart, and then the next person does everything absolutely right, but because of genetics, whatever, their heart just isn't as good.
Okay. So it's just preventative, doing the best that you can do to continue to maintain as healthy lifestyle, healthy heart as possible.
Well put.
Yeah, exactly.
Okay, there you go. Very, very
End
good.
of story.
End of story. So on some of the heart healthy side is like working out, like lifting weights, or are you more recommending, or would you recommend more cardio, like
That's
light
why they
walking?
call it cardio.
Okay, that's what I was getting at. So
Yeah.
like maybe walking, like just taking your dog for a walk, or just walking around the neighborhood, anything like that would probably be a really good exercise versus just like, you're not recommending like weightlifting, anything like that.
But I am for something else.
Okay.
So we do our walking or our belly dancing, of course, which is also another big favorite exercise
Ooh,
of
I like
ours.
that.
But why would we lift weights? Because along with that fat going up 1% per year, we lose 1% of our muscle mass per year every year after age 40. So again, you could lose 30% of your muscle mass as you get older. That's why when older people fall, half of them can't get up off the floor because they've lost the muscle mass in the upper body. So you do the weightlifting, and I really recommend you get somebody who knows what they're doing to make sure you don't injure yourself. But you're building up that upper body, and of course there's back and lower body. What does it do? Well, it's burning calories, and it's building the muscle so that if you do fall, you're a little stronger. You can get yourself up. If you have more muscle mass, maybe you'll protect those bones from breaking because they're more supported.
And if you're a caregiver, you can provide better care. You're not going to injure yourself caring for your loved one if they need assistance getting from the chair into the bed, or out of the bed into a chair, or assistance in the shower, or anything like that. You have the body strength that you can help them without hurting yourself. So it's very, very important to build those muscles, keep them lean and strong, and not only you're taking care of yourself, but you're going to be a better caregiver to care for someone else.
Yeah, absolutely. Yeah, and even some of these exercises can be done sitting with just simple, like, what do you call them? Dumbbells? Dumbbells, just simple dumbbells, really lightweight, just to keep, you don't have to be a bodybuilder, but just keep them strong so that you have that muscle mass that you need to maintain.
We recommend, there's a lot of good shows on TV, the Sit and Fit, even the yoga, and just, 30 minutes, 30 minutes. Even I'll tell my caregivers, get up, if you're sitting and watching TV, get up and do something during the commercials, some type of exercise during the commercials, because you'll find that eventually you'll turn that TV off because it gets the blood flowing. You're going to feel better, and but just do something.
Right.
And that's a great start, because we'll tell people, because nobody has time to exercise.
Right.
So, okay, can you give me a minute a day? Well, I guess I can give you a minute a day. Okay, now 3 days later, could you give me 2 minutes? How about 5 minutes? And the next thing you know, you're exercising the 20 or 30 minutes 3 times a week that they recommend you get.
I really like the commercial idea because especially for people that are stationary watching a lot of television, and the commercials, let's be real, who really cares about the commercials? I won't say that in front of sponsors, but I mean, at the end of the day, and you can exercise and keep the commercial on. It's just background noise for the most part anyway. And you can get that in, and then you can take that break. And that can really be, if you're getting up and doing an exercise every commercial break, that's really actually pretty good. You're getting quite a bit of exercise in, and you're right. I will bet you money. You start doing that, you're going to forget about that television program that pops back on, because you're going to start getting more and more into what you're doing, because you're going to feel really good once you get that adrenaline going.
I have one caregiver in my group. she only puts one thing away at a time. Instead of carrying a stack of like the towels, the washcloths, and the hand towels, she'll carry just the washcloths and put them away, and then she goes back and gets the other. So she's making multiple trips, but she's doing it intentionally, so that she's caring for her loved one, but she's walking a lot inside the home because she can't get out and do a lot of other things. But she's purposefully doing things in the house because she can.
Right.
While she's cooking, she's using cans of soup and doing the exercises there. And it's comical because we've laughed at her, but she's demonstrated in the group how she's doing this. So she's making the best of what would seem like a bad situation, but she's actually shown us what she's doing. She's doing, leg lifts while the microwave's going, other things like that. When she goes out to the mailbox, she does 3 trips out to the mailbox, into the driveway and back. And so you could do your own little exercise routine, and you'll find that you can build off of it.
Exactly. When there's a will, there's a way.
But always get clearance from your doctor before you start any exercise program.
Yes. Always want to preface that. For
absolutely.
Sure. Yes. Well, ladies, we are at the bottom of the hour. We're going to take a quick break, and then we're going to be right back.
Okay.
At Parish Healthcare, we believe in our community. We believe in keeping our community safe. We believe in the art of healing. We believe in healing patients, healing families, healing communities. We believe in the best and brightest working together for the common good. At Parish Healthcare, our team focuses on you as an individual because every life is a work of art to us. Parish Healthcare, where the art of healing comes to life. Visit parishhealthcare.com/healthaware for a free health risk assessment.
Hey, Mom, how's the retirement home search coming?
Oh my gosh, I'm just so stressed out. I don't even know where to begin.
Well, why are you so stressed? What's the matter?
I don't know where to find anything. I just need everything in like one place and know what all the options are.
Does the idea of searching for senior housing seem overwhelming and you just aren't sure where to even begin? SeniorLivingGuide.com has great news for you. We offer a one-stop solution to take the stress out of your senior housing search. At SeniorLivingGuide.com, both our statewide Florida edition book and website are created to make your senior housing search very easy for you to navigate. We provide details on communities, including retirement, assisted living, skilled nursing, memory care, and home health, allowing you to decide which best fits your needs and then connecting you directly with those communities. Visit us online at SeniorLivingGuide.com and start your search today and start de-stressing.
At Parish Healthcare, we believe every life is poetry in motion, motivated by strength and determination. As your bone, muscle, and joint healthcare partners, we believe in blending the art of healing with the science of medicine to keep your body in motion. We believe in healing patients, healing families, and healing communities. For a free orthopedic health assessment, visit parishhealthcare.com/orthoaware. Parish Healthcare, where the art of healing comes to life.
Welcome back. Thank you for joining us again on SeniorLivingGuide.com podcast, sponsored by Parish Medical Center and Healthcare. We have Dr. Pam Trinetti and Janet in the house. Again, thank you, ladies. So we've been talking about our topic is basically everything is going to change, and you got to change with it. And so we've been talking a little bit about all kinds of different things on your body, all the way from skin to heart. So let's talk a little bit about, we just finished talking about the heart. So another vital organ, clearly, are your lungs. Mm-hmm. So what are some changes that happen as you age with your lungs?
Well, before I went to medical school, I thought the lungs were like balloons. You filled them up. They're sponges.
Oh.
And as we get older, everything does what? it dries up. So
Is that the word of the day?
it is the word of the day, is dries out. So the lung tissue actually kind of dries out. And you have the same kind of changes as somebody with emphysema. And so you don't have that reserve. You don't maybe have that ability to cough deeply. Plus, with your loss of muscle mass in your chest wall, so you might get something in your throat and you can't quite cough it up the way you once did. The other thing we talk about, what do the lungs do? They absorb oxygen. Well, did you ever find that sponge underneath the sink and it's really hard and crackly? You can't wipe anything up with it. So if your lungs are, the tissue is a little crackly, it doesn't absorb the oxygen and then transfer it into the blood the way it did.
This is really awesome information, because it's not some, you always think of the lung like a balloon, and you don't realize that any of what you just said, because I honestly never knew any of that. So it makes any sense that your lung would age really any differently than anyone else's. But that is definitely not something I've ever thought about as to why it definitely decreases in strength as you age, and ability to, I guess, has infection issues and things like that.
It does. And just, why can't I run as fast? I used to be a marathon runner. Why can't I do that? I seem to be getting a little more short of breath. Now, here's where we walk between, hey, if you're getting short of breath, you don't just say, oh, well, it's because I'm older. It's you go figure out if something is wrong. And the other jumping off point for me is, I'll read somebody's chest x-ray and I say, oh, I see you have some changes for that look like COPD, chronic obstructive pulmonary disease, emphysema, and they go, I have what now? Well, this chest x-ray was done 2 years ago. We tell everybody, as our seniors, if you get a test, you get a copy of the test. And you look at it, and you have somebody, if you don't know what it means, have somebody explain it to you. And keep a little file folder of, this was my CAT scan from 2 years ago. This was my echocardiogram from last year. So you understand and have control about what's going on with your body. If you get a blood test, the answer is not, it's fine. Fine is not a blood test answer. So we want to empower people to get copies, know what's going on.
So you mentioned COPD. Is that something that just smokers would typically get?
It's something that smokers get, but it's the same changes we see in people in their late 70s, 80s, and 90s. Most of the chest x-rays look like a COPD patient.
Okay, but they're not.
No, they're not.
It's just an aging...
Right, and the people are shocked because they say, but I was never a smoker. You don't have to be. It's the aging changes.
Oh, bless their hearts when they hear that. They maybe think they were like exposed to something, right? Yeah, I can see where that completely
Or
would.
they may have been exposed to something.
Right. So is there a way to, is that treatable? Is that something you treat, or is that just something that it is kind of what it is?
It's a little of both.
Okay.
Because maybe you need an inhaler. Maybe you need to take some weight off to help those lungs not have to work so hard. Or maybe it's just, okay, I've got to modify. I've got to cope and compensate. So instead of being a runner, maybe I have to be a walker.
Okay. So we go back to diet again. So a little bit of diet in there. Is a heavier person that has COPD, taking a little bit of that weight makes the lungs work less harder.
Exactly.
Is what you're saying. Okay. That makes sense as well. When the body weight always makes the body work harder on probably most organs, correct?
Well, here's another fun fact, and that's that with every step you take, it's 3 times your body weight per square inch on your knee joints. So if you weigh 100 pounds, it's 300 pounds per square inch on your knees with every step you take. If you weigh 300 pounds, then it's 900 pounds per square inch. So that's why when people say, gee, I have some arthritis in my knees hurt, again, take that workload off the knees.
World of difference, right? Yeah, very, very interesting. So we talked a little bit about the lungs, and we're going to talk more about what you actually specialize in, the brain, and a little bit about memory and dementia, which is something that really does plague our senior our seniors in general. I know it's something that I know they're very fearful as people age, that's something that they may get, especially if it's something that maybe ran in their families, because it can be inherited from what I understand. I think maybe more on the Alzheimer's side, and I could be misspeaking on that. But so tell us a little bit about the brain and how it ages and how it can affect seniors.
Well, maybe my friend, what's your name?
Janet?
Yeah.
Exactly.
Yeah. Just like all the other things we talked about, that there are normal changes with age, and then there is disease that affects. As you get older, you get better and better at forgetting. One of my patients said, my rememberer isn't working anymore. So yes, normal changes of aging is you forget words. You forget your friend's name. We tell a story about a lady went to her pastor. They were talking, and he's like, you know, at your age, you should think about the hereafter. And she said, oh, I do all the time. I go in the garage, I go in the pantry, and I say, what am I hereafter?
That is hilarious. That's funny.
So,
But that's normal to walk into a room and say, now, what did I come in here for? And then you walk out and it clicks. And you think, okay, but to know that you walked in there for something and you had a purpose, that is normal. To make a meal and you sit there and go, okay, there's something missing. Oh, yeah.
left the biscuits in the oven.
I left the biscuits in the oven or the coleslaw's in the fridge. That's normal. But to forget that you even had coleslaw or that family's even coming over to eat, that's not normal.
Right.
You deserve an evaluation, and that's what we do in our office. You know, 1 in 3 people over the age of 80 will have some form of memory issues. You mentioned Alzheimer's. That's one type of dementia. Dementia is not a diagnosis, it's a condition. So Alzheimer's is like a ball rolling down a hill. It goes kind of slow. It can be up to 20, 25 years. And there's a whole bunch of different types of dementia.
About 50.
Yeah. And so what we do in our office, Dr. Trinetti is a geriatrician. She specializes in diagnosing memory issues. She's board certified and she's phenomenal. I'll say that. I love her. But you deserve an evaluation. If you've got memory loss, you deserve it. I, as a social worker and a certified dementia practitioner, I'm there for the family to provide education, support, and resources because they don't know. They don't know. Their heart's broken, or they're frustrated and their heart's broken. But to find out what support they can give, because 9 times out of 10 or 99% of the time, the person that has the memory loss is not doing it on purpose.
Right.
They're not doing it because they want attention. They're doing it because they can't help it.
So the earlier diagnosis is the best, because I know that is definitely, from my personal experience and the experience I've learned over some period of time, people avoid or acknowledging that it's happening. So instead of jumping in and getting it diagnosed quickly, they'll try to they don't want to acknowledge that it's happening, so they don't get it diagnosed early. So you definitely recommend, or do you recommend getting an early diagnosis and treatment as early as possible if you think it's a possibility?
Yes, because we'd rather tell people, you know what, we're not seeing any signs, this is normal aging. And yeah, back when I started doing this 30 years ago, people didn't bring their loved one to me until they got to the point where they couldn't fix a meal. They couldn't get dressed. Now folks are coming in saying, you know what? My husband was an engineer at NASA, and now he's struggling to use the computer. Things are difficult for him that shouldn't be. And we make the diagnosis early because there are things that can make it look like dementia that aren't. We often tell about people who've actually come to our office being told they had dementia, and you know what they had? their ears were full of wax, and they weren't hearing what was being said. So that's why they didn't know they were going to lunch the next day. There are people who have sleep apnea, and so they're foggy. They're not thinking clearly. So you treat the sleep apnea, you get the ears cleaned out, or you change the medication that they've been on that's now causing a side effect. And guess what? It's back to that normal aging. You know, the brain changes, just like everything else we've talked about. There's shrinkage of the brain, loss of brain tissue, hardening of the arteries, so there's less oxygen and nutrition going to the brain. The electrical system, just like in the heart, there's an electrical system in the brain, so the little messages from one brain cell to the other aren't quite as fast as maybe they used to be. If you do intelligence tests on older people versus younger people, if you time them, the older people don't do as well.
Right.
If you take the time limits off and give them all the time they want, it's about equal. Sometimes Janet and I, we talk about the filing cabinet, that when you're 20 and you get your first filing cabinet, what's in it? There's like 3 or 4 files, you know, your school grades and your car loan. By the time you're our age,
it's packed.
Yeah.
Right.
and you know, we've got a little cartoon thing to where it's a filing cabinet we do with one of the presentations we do. The cabinet drawer is not even closed. It's just paper sticking out of it. So you think, you know, you ask somebody a question that's a senior and they're going, now wait a minute, I know that answer. But to go back through all those files and to pull it out,
Right.
it's like,
Right.
they can't pull it out.
Right.
So to be able to do that, you know, yeah, well, you know, I don't know.
Right.
Like Dr. Pound was doing, trying to remember my name. You know,
I really knew it, Janet.
yeah,
I really
know
did.
she did. But I'll just, you know, but it's like, okay, I know that, you know, but also with our patients or with some seniors that may have the dementia, they can tell you in detail about what happened when they were in high school, when they played football, when they did whatever they made raising their kids, but they can't tell you what they had for dinner last night.
Right.
They can't tell you what they had for breakfast, but you get into talking about their military service, something that happened years ago. That's deep in the brain. Those memories are deep seated, and so, you know, the brain may be shrinking and gaps in the memory, but those deep-seated memories are there.
Does anxiety and depression ever play a role into progressing Alzheimer's or dementia at all? Is that something that, or can anxiety and depression mimic a dementia?
Both.
Oh, wow.
Somebody
okay.
can have depression and, gee, they're not eating right, they're not bathing, they're not paying their bills because they're just too depressed, not motivated. Vascular dementia, little tiny mini strokes in the brain, is really associated with depression quite a bit. So you can have them go along together.
And they can have behavior problems to where that they're so frustrated they can't remember something.
Right.
And so they will strike out. And they'll strike out a lot of times at the people they love, the people that are there. And it's not because they're angry at them. They're angry and frustrated because they can't remember. Now, what is that? Don't bring me that.
Right.
You know.
Right, exactly. Interesting. So it really is a proper diagnosis. So with the different types of dementia, you said there's 50? How is that difficult to diagnose and treat those different types of dementia, or are they all treated basically the same? It's just understanding how they all work as far as being able to work with that patient to meet their specific needs.
Well, we say if you know one dementia patient, you know one dementia patient. Everybody is such a unique individual. So the workup is a history, a physical exam. Look at the medications, look at the medical problems, blood work, brain imaging like an MRI, you know, sometimes a test for sleep apnea. You make your exact diagnosis. And then there are specific treatments for specific types of dementia, but we generally will use the memory medicines that we have for all of them. You know, some of these are so rare and unusual that we will send people to the Mayo Clinic or another tertiary care unit because they'll do spinal taps. They'll do really precise imaging studies of the area of the brain, and they can tell us exactly what's wrong.
Very interesting.
And it's very important also with us, we get a good history from the family. You know, when did you start seeing this? What type of personality have they had? You know, did their education level, what, you know, the reporting from the family, I often refer to it as puzzle pieces. You know, we do a memory test, but that's one puzzle piece. And we just kind of put the puzzle pieces together, and that's how Dr. Pam gets the diagnosis. Sometimes it may be ruling something else out in some of the testing, but to kind of put it all together, and it's when it's there, it's a relief for the family. You know, it's difficult when you know when she has to go in and tell them that, but you also see a relief because
Right.
it's
Yes.
like, oh well, I knew something was wrong. I knew it, and you know, and
It's
also
just getting the answer.
and
Yeah.
also for the patient, you know, I knew something was wrong. I know now.
Yeah. So I definitely want to dig in on the dementia on a whole podcast
Yes.
at some point. But so let's move on a little bit. So we're talking about, because we were going to do a whole podcast on from, you know, the outer to the inner. So we're going to talk a little bit more about seeing, hearing, smelling, and tasting. So that's quite a gamut.
That is.
Yeah. So tell me a little bit about how all those are affected as you're aging. And I definitely want to talk a little bit about the hearing part, because hearing can definitely be a pestle with seniors.
Huh?
I almost want to say, and I may be just like spitballing, but I feel like men are a little bit more difficult with the hearing side as far as acknowledging that maybe they have issues. Am I right?
It is, but it's a little of both, because as we get older, our voice changes too, and especially women. The vocal cords change, so maybe our voice is more like this, and our husbands can't hear us as opposed to this. So, yes, what always kind of puts me over the edge is nobody would say, you know what, I really don't want to wear glasses. I'm just going to walk around and not see. But I hear so many times, I don't need a hearing aid. I don't want to wear a hearing aid. What you don't realize is that if you don't have that stimulus going into those ears, the whole area of the brain that processes sound starts shriveling because it's not getting any input. So it is crucial, if you have hearing loss, wear your hearing aids. Get tested, find something you can afford, and realize that you're worth it.
Exactly.
So, okay, I'm going to spend $1,000, but I'm going to live 10 years. So is it worth $100 a year for me to be able to hear?
And there's a lot of affordable hearing solutions out there.
There are now, yes.
There are so many, even getting diagnosed and then ordering by mail. I know that there's so many different things that you can do if you feel like it's something that is a cost issue. So it's just finding some of those answers and exploring them. I think you can really.
Yeah, absolutely.
But yeah, so does your taste and your smell, does that change
Yes. Yeah, it takes...
for the better or for the worst?
Depends.
So far, what have I been telling you?
I was
If
going to
things
say, does
sounded
it
better or worse?
I don't know. Does it help with the diet side?
No, it usually takes about 3 times the amount of salt as in a younger person to even identify it as salt. So a lot of people will say, this food doesn't taste like anything. And I'm supposed to be on this low salt, low fat diet, and I don't even want to eat because it doesn't taste very good. So
it's worse.
It makes it tougher. And fruit flavors, it might take 7 or 8 times the concentration of fruit flavors to even identify the taste. So,
Oh, wow.
so a lot of times, again, this is for a patient that I know, and I know their whole dietary history, and I might say, you know what, go ahead and put salt on homemade food because that'll make the egg taste better, or it'll just make you eat a healthier diet if you enjoy the flavor.
Right. Now, is there a salt substitute that you can utilize that works?
Yeah, Mrs. Dash is one brand. There's all kinds of spices out there that, give the foods a little different flavor and intensify
Okay.
the taste.
Yeah, that's a good idea to do some Mrs. Dash and kind of work with that.
Mm-hmm.
So we'll talk a little bit. Our next subject, I think, would be the GI tract.
Mm-hmm.
This is obviously very important and something that maybe some people aren't super comfortable talking about, but it is really, really important. So tell us a little bit about how that changes and how important it is to have your physician, have that conversation with your physician.
Well, let's start right in the mouth. Yeah, we've seen people who have problems actually swallowing, that all the muscles in the back of the throat have to coordinate to get the food down. We just take it for granted. And then we think that the esophagus, the tube between the mouth and the stomach, is like an empty elevator shaft. But it's not. It's all muscle.
Okay.
So it's literally squeezing the bolus, as we call it, of food down into your stomach. And
And what you were talking about earlier, as far as everything drying out, the mouth is drying out too.
Yeah.
And, you know, we drink a lot of water. I've heard so many seniors say, I don't like the way it tastes. Well, you know, to me, water doesn't have a taste. But to get a senior to drink water sometimes is as bad as pulling teeth.
Right.
Because they do not want to drink water.
So when they come to you and talk to you about some of these things, is this something you have to kind of talk to them about, or is this something that they're willing to talk to you about because they really are having a problem that they acknowledge, or are you asking this when they're coming in for an evaluation?
A little of both, because we talk about, are you having any problems with your stomach? Are you having reflux? Is food getting stuck? And other times folks come in and say, hey, I've got this new problem. My stomach hurts. And, you know, of all the age groups, older people are the ones who are having more ulcers, bleeding ulcers.
Wow.
Because the lining of the stomach thins. You know, did you ever do a science class project where you put a nail in a beaker and then you poured a cola product over it and it kind of dissolved it? How come it doesn't dissolve a hole in your stomach? Because you have this lining that's always replenishing itself. As you get older, it doesn't do that as efficiently. Plus, all of the anti-inflammatory, all the arthritis pills, Motrin and Aleve, I hate to use the brand name, but ibuprofen and naproxen, all those things, if you just take them, they could be chewing a hole in your stomach and causing an ulcer. And you're not feeling it because you're not feeling that pain.
Interesting. Now, does diet, if you've been someone that ate a lot of spicy food or drink a lot of coffee, anything like that, does that contribute to that as well? Or no?
Not so much. Those contribute to a lot of acid reflux going up into the esophagus.
Okay. So you definitely would want to cut that out if you have.
If you have symptoms,
If you
that'll
have
be
symptoms.
that would be part of your treatment plan.
Okay. All right. I'm sure there's probably a whole list of foods that cause the acid reflux.
Discomfort.
Discomfort, yes, I'm sure. So let's talk a little bit about something that I definitely know happens in seniors quite a bit, and it's constipation. And I know you're probably talking to them quite a bit about how to solve some of those issues. So what causes that to be more frequent with seniors? Is it going back to the diet, or is it something different?
I think a little of both. I mean, you know, things are drying out. They're not eating a healthy diet. Lack of mobility. You know, just sitting around due to a physical limitation or safety, the safety concerns. They're home and no appetite, so they're just eating sweets, eating a Danish, eating a piece of toast, 1 cup of coffee, lack of fruit or whatever it may be, and so the gut's not moving.
Right.
And
Not enough fiber.
Not enough fiber.
Yeah. How much fiber does the American Cancer Society want you to eat a day?
I have no idea.
It's about 30 grams. Now, how many grams of fiber in a tablespoon of like a Metamucil product?
I have no idea.
About 3.
Okay.
So, now, not that you go out and have 10 spoonfuls of Metamucil. That'll cause something we call a bowel blockage. You don't want to do that. But it tells you that you have to find this fiber in very many places. Cereals, prunes, fruits, vegetables.
Yeah.
And you're right, Janet,
Yeah.
that folks are eating tea and toast or Danishes. And then water,
Yeah.
fiber, exercise.
You know, I grew up hearing the term or the phrase, apple a day keeps the doctor away. Well, you know, you bite into an apple and you chew it up and this sort of thing. But, you know, seniors may have dentures, may have, you know, the teeth. They're not going to bite into an apple. Or if they do, you know, and so it's lack of that pectin or that solvable fiber.
Right.
And so there sets the guts are going to, it's going to get constipated.
Right.
And
Yeah.
if they load up on the Metamucil, that sort of thing, then it's just going to sit there.
Yeah.
There's nothing to push it through.
So it goes back to diet and exercise.
Yeah, it kind of does.
Yeah. Theme of the day. So going back to the other issues that we have, and I don't know if this is going to hit the theme of the day of the diet and the exercise, but the bladder control issues, and it very well might. So this is definitely an issue with seniors, and I know it's an issue that they probably don't like to talk about. I know that sometimes it's a very hard subject, but one that clearly needs to be addressed. So what causes some of these bladder control issues as seniors grow older?
Yeah, some of it is the musculature, that it just doesn't hold things in as well as it used to. Some of it is actually some of the foods and drinks that we take in. We don't realize that caffeine-containing beverages and artificial sweeteners, sodas, are all bladder irritants, and they can cause the bladder to kind of spasm and you lose control. I think sometimes people have other reasons for lack of bladder control, like if you have arthritis and you say, gee, I have to go to the bathroom, but I can't get there in time, then you have a little bit of dribbling.
Right. Yeah. And people that are less mobile, they may just not be able to get there because just the time frame is just,
And also dementia. You know, someone that has dementia, they think, oh, I need to go. Stand up. Oh, what was I doing? And then you add the lack of control. Stand up, the bladder, lack of control. Oh, what was I doing? Oh, and then get distracted, sit back down. And so it all kind of plays in there together. So, yeah, we had a little demonstration in the office. I was demonstrating to Dr. Trinetti earlier this week on just that exact same thing.
Right.
And, you know, which she knew what I was doing, but, you know, we kind of did a little game, role playing along that. But it happens, you know. And, you know, there's a lot of pads, adult garments, and this sort of thing.
Yeah, we never say the word diapers.
No,
Right.
oh
It's
no,
protective undergarments
Right.
or little pads. And the other problem is the urinary tract infections that can cause irritation of the bladder, and then the person loses control.
Exactly. Well, that's good to know. And the protective undergarments, they're making them so seamless.
Oh gosh.
You would never know that you're wearing them, and there's nothing to be ashamed if you need to wear them. So I just, you know, I want seniors and elderly and caregivers to know that that's something that never discourage someone that needs to wear them them.
But the flip side of that is I've had people come in and say, well, Doc, I'm old. And I'll say, why are you old? You weren't old 3 months ago. What happened? Well, I can't control my bladder. So I'm wearing these undergarments. Well, wait a minute. Maybe there's something wrong.
Right.
Maybe there's something we can fix.
Sure.
Let's find out what's causing the problem. And then it's okay to wear the supportive garments if you need to, but let's see if it's something we can help you with.
Exactly. So
Tell somebody.
So if it's starting to happen, check with your doctor, see if there's something that's causing it before you just say, I'm old and that's the end of it.
Yeah.
Exactly. A urologist, a urogynecologist. We have marvelous medications and procedures that can help strengthen that bladder.
Yeah. That's good to know. Well, thank you, ladies. We are at the end of this week's podcast. Thank you, everyone, for joining us with SeniorLivingGuide.com podcast, sponsored by Parish Medical and Healthcare. And we will see you next time.